Well, bariatric surgery is becoming one of the most popular of the plastic surgery options and certainly helping so many people just change their life by losing weight. But then a lot of times you're left with excess skin. Well, there's a whole nother procedure that can help there, and somebody who could better tell us about it is Dr. Jason Leedy, who performs that kind of plastic surgery so often. And well, starting with the bariatric surgery, how is it more common for people to have excess skin, or are there some who can go through it and not have the excess skin?
Well, it varies from person to person. First, a little bit about myself. I'm a plastic surgeon. I'm board certified by the American Board of Plastic Surgery, and I perform a lot of gastric bypass procedures, the body contouring afterwards. And every individual is different. Not all people are troubled with the extra skin, the loose skin afterwards. Some end up with a nice shape afterwards, but all too often, after the fat cells have disappeared, the extra skin remains, and it can be a real problem for people.
Is that age related? Does it seem like older people tend to have more of the excess skin than somebody younger going through it?
Well, not necessarily, but as we do age, our skin loses its ability to retract. But everybody's different. A young person can be troubled with lots of extra skin after massive weight loss as well.
Is there any part of the body that the skin is not as elastic as others? Like, what part of the body do you end up most often fixing after bariatric surgery?
Well, there's usually four main areas. The most extra skin is often around the torso. The abdomen and the posterior part of the body. The arms are often affected, the medial thighs are affected, and the breast and the male chest is also a problem area.
And then, so what would be the options for someone to get rid of those areas and get rid of that excess skin?
Well, there are a variety of surgeries that are available. When somebody comes in and we start talking about these procedures, or they're interested in how they can change their body, first and foremost, they have to meet certain criteria to make sure that it is indeed safe to proceed. People need to have stable weight. Their weight needs to be at least at their target or stable for at least 6 months. And often that means that they're at least 18 months out from their gastric bypass surgery. Their medical problems need to be well controlled. High blood pressure needs to be controlled. Pulmonary issues need to be stabilized. And they need to have realistic expectations on what can be achieved. We go into talking then about the different options, and this is major surgery with potential for real complications. So patient safety is number one. In order to maximize patient safety, the surgeries are staged. We cannot do everything in one operation. That's just too much for someone to undergo. So in general, start with the body and often add to that the arms. There's two main body procedures. There's an abdominoplasty or tummy tuck, which just addresses the front, or circumferential, which goes all the way around. And
you brought some images with you to give us a look. So obviously a before and after. I think we can easily tell which is which. What is the procedure that was done here?
Well, she underwent a laparoscopic gastric bypass surgery, and that's the surgery that's done through the small incisions. And then you can see on the left where she has the significant extra skin and the rolls of skin. And her main concern was she wanted to improve how the tummy looked. So we did an abdominoplasty, just addressing the front, removal of the extra skin, tightening the muscles, and resighting the belly button.
And then the other term you mentioned was circumferential?
Correct, the circumferential lift, or the lower body lift. It's a much more powerful procedure than just doing the front part of the abdomen. This patient underwent an open gastric bypass procedure, and she had significant weight loss. We went all the way around her body. She has an incision that goes in the bikini line all the way around, and also one up and down to help further tighten the abdomen.
Yeah, so you can't really see scars at all. Now, obviously, those are both women, but men undergo this same procedure as well.
Absolutely, absolutely. And about 20% of all cosmetic procedures involve men. More and more men are considering body contouring after gastric bypass surgery. And
that's great. You guys do a good job with it. Well, I want to let people know how to get in touch with you.
Great.
It's Cleveland Plastic Surgery Institute. It's in Mayfield Heights, 440-461-6100. That's their phone number. If you want to get in touch with Dr. Leedy, it's drleedy.com, L-E-D-D-Y, or goodcompany.show.com. Well, Dr. Leedy, good to see you, and I'm glad that you do what you do. I mean, that's a much-needed procedure.
Thanks for having me.
Well, we are